If you're about to start your clinical placements as a medical student, don't make these mistakes that I see all too often. In this video, I'll tell you exactly what you need to do to squeeze the most out of your placements to benefit you and also pass your exams. I'm Sanjay, a GP and medical school lecturer, and if you're a medical student who feels a bit lost or you want to get ahead, you might want to hit that subscribe button for more content like this. Firstly, I think it's really important to recognise that there will be a gear change as you move from your preclinical years to your clinical years, and there'll be a higher expectation of you in many different respects. So even if you felt that you coasted through your preclinicals, this should be a wake-up call that it's time to buckle down. Now let's address the biggest mistake that most students make as they enter their clinical years. Because so far you've been in the mindset of acquiring knowledge and passing exams, and while that continues to be important in your clinical years, there are a lot of other important things that you need to build on as well. If we were to categorize all of the major components of your training in medical school, it would look a bit like this. In your preclinical years, if we were to put this on a graph, the balance of the importance of these different categories would look something like this. There's a much greater emphasis on the knowledge, but less so on the skills, though you get an introduction to these things. But now compare this to the balance in your clinical years. There's now a much greater emphasis on the skills than just the knowledge. And the mistake is that most people don't realize this. They're stuck in the mindset that the only thing that is important is to pass the exams. So many students make a decision to miss out on clinical placements because they convince themselves that their time is better spent studying. But this is a bad idea, because the knowledge itself is not the most important thing anymore. It does still have importance, but it forms the base layer upon which everything else rests. So I'm not saying you shouldn't study, but you need to allocate your time more wisely. So my advice to students, based on my own experience, is this. Spend your own time when you're at home and in the evenings and weekends studying and building that knowledge. But when you're on placement, recognize that you need to hone your skills. So prioritize this over just sitting in a corner and just reading notes. So how do you hone your skills on placement? There are many different aspects to this. Firstly, be a good observer. I often hear medical students complain that they don't feel involved or they're not given the opportunity to practice certain skills. But nothing will stop you from using your skills of observation. And don't just be a passive observer, be an active one. Watch how the staff interact with each other and with their patients. Don't just look at the big picture, but focus on the small details. Identify the kinds of behaviours that you like and respect, with an aim to emulate this as you grow with confidence. So if there's a consultant or attending who comes across as very kind and warm, who people listen to and admire and respect because of this trust, take a note of those little details. Look at their verbal and non-verbal communication. How do they build rapport with patients? How do they ask members of their team for help or advice? But also identify any negative behaviours that you dislike. Is there a consultant that comes across as rude or disrespectful, or commands respect through fear rather than trust? Make a mental note to yourself that this is not the kind of person that you want to become. So identify any weaknesses in their style of communication so you don't make the same mistakes yourself. And the same applies for any practical skill. Every procedure or examination has a checklist, right? So if you're observing a senior do a procedure, such as putting in a cannula or inserting a catheter, don't just passively watch what is happening, but actively think about the steps that are involved and try to recall the checklist for that procedure as they are doing it. Or if it's one that you're not familiar with, make a mental note of the different steps involved and then look at it when you get home. When you're on a ward round, look at the way the doctors and nurses interact with their patients. Have they explained things well, or do you think that the patient's concerns were not fully addressed? If so, why? What could have been done differently? Use your skills of reflection to think about this more deeply afterwards, and it will be great for your e-portfolio. Even if there isn't a specific procedure to watch or a ward round to be part of, you can still ask to speak to patients and tighten up your history-taking skills. And you can then practice presenting this to one of the doctors, or if they're busy, at least presenting to another student and giving each other feedback. Even looking at the patient's notes can be helpful. Look at how the doctors take notes and document their history. It's probably a lot more concise than what you might be used to, so you can learn from this. Look at the differentials they've considered and try to understand why. Look at the patient's journey from admission to the current day, and look at the decisions that were made about treatment, such as why they chose a specific antibiotic or another medication. And if it's not clear, ask someone or look it up. Hopefully you're starting to see that there is so much to learn in a clinical environment, so it just doesn't make sense to miss out on all of this by skipping your placements and just studying on your own at home. So far, I've talked about things that you can do as an active observer, but there are even more things that you can do by getting stuck in. Whenever you are presented with an opportunity to practice a new skill, say yes. Don't shy away from the chance to learn this, which may not come around again. And again, there are so many little details to learn about practical procedures that you simply won't learn from a textbook or a website. You need to actually do these for yourself. So let me use an example of taking bloods from a patient to demonstrate the importance of actually getting enough practice yourself. Firstly, if someone asks you to take bloods from a patient, say yes, and ask for supervision and help. If you feel uncertain, ask to observe them first with one patient, and then you can try with another patient. And again, many people make incorrect assumptions that taking blood tests is a waste of time, but honestly, it's one of those things that you'll be expected to do all of the time when you start working as a Foundation Year 1 doctor, and you might not be as well supervised at that point, so doing this as a medical student is a much better opportunity. And it's not just the act of inserting the needle and withdrawing the blood that is important. One of the most valuable lessons I learned when taking blood is to be well prepared with all of the kit in advance. And this isn't written in any textbook, so it's something you need to familiarize yourself with by either asking someone or getting used to doing it yourself. So it means getting your tray ready with the alcohol wipes, tourniquet, some gauze, getting some micropore tape already cut and ready to put on. All of these little steps which might seem inconsequential, but trust me, when these are all ready and right next to you, it stops you faffing around later. You'll also learn about some little tips and tricks that seniors have found effective when taking bloods from a patient, and this kind of wisdom is gold. And finally, it's a good opportunity to learn exactly what blood tests have been requested and why. And if you're not sure, then ask why it's important that this particular patient has their renal function checked today, for example. Because we don't just order tests randomly or a whole bunch of tests with no idea. We should target what we think is going on. This also means learning which tests go in which coloured bottle. Again, the more you do this, the more you'll get used to knowing, for example, that a full blood count goes in a lavender top bottle, and you'll learn the trick of not letting this clot, because otherwise the lab can't process it. On the other hand, a bottle with a light blue top is to carry out a coagulation screen, and these bottles need to be filled to a particular line. Too much or too little, and the lab will simply reject this. And there are few things more frustrating for both you and the patient than having to re-bleed a patient who already struggled to get much blood out of. So hopefully that example of taking blood has demonstrated all of the tiny bits of knowledge that you can soak up just by getting involved and doing things. And you'll miss out on all of these by sitting on the sidelines. There are plenty of settings where you can do this, whether it's a patient in a GP practice, or someone who's just been admitted to the emergency department, or a patient on any ward. Take these chances to practice this skill and present. And while doing so, try and think of the differentials in your head and the potential management options. And then clarify this with a doctor after you've presented. There are many different clinical examinations that you need to become comfortable with. And believe me, it's really obvious when a student hasn't practiced these enough. You want to get to a stage where you can do each different clinical examination accurately and efficiently. So whenever you can, practice this again and again until it becomes second nature. In particular, make sure you ask the doctors if there are any patients who might have some clinical signs that you could potentially identify. Maybe you're on a gastro ward and there could be someone with signs of liver failure, like jaundice or hepatomegaly or ascites, for example. Take the initiative to do this, because medical school is your best opportunity to see a wide range of different patients, and it's okay for you to not know the answers. There are some core skills that you will need to know, and then there are some which are nice to know but not essential. Ask the Foundation Year doctors what practical procedures they do the most, because that's what you'll need to be doing someday soon. This will include taking blood, inserting a cannula, a catheter, doing an ECG, and a few others. Again, it's blindingly obvious when someone isn't confident doing these, so take the opportunity to practice on simulation models as much as you can, and then with patients. So hopefully you've realised from watching this video that being present and engaged with tasks on your medical school placements is really important. It will build up the skills that are going to be vital when you start working as a doctor. Don't miss out on these by just staying at home and studying. I hope you found this kind of video useful. If you liked this style, then let me know and I can make more of these in future. In the meantime, you might be interested in this video, which talks about how much junior doctors are paid, or this one on how much GPs are paid. And I will catch you next time. See ya!